Hello, everyone. My name is Greg Carter. I'm the Deputy Director of Communications for the Virginia Department of Corrections. And in this edition of VADOC In Focus, we're talking about vaccine hesitancy and some of the reasons why individuals in Virginia and across the country and really across the world may be concerned about the COVID-19 vaccine and putting off getting it or have decided altogether not to get it. And we're going right to one of the experts here. We are pleased to be joined by Dr. Gregory Madden. He's the Assistant Professor of Medicine at the University of Virginia. Thank you so much, Dr. Madden, for joining us for this conversation.
Thank you for having me.
So let's get right into this conversation, and I want to first just go right toward the topic of safety when it comes to the COVID-19 vaccine, because early on, that's the topic a lot of people jumped on was, is it safe? Um, where are we right now in this conversation, and how are we doing in helping people understand what this vaccine is made of, the science behind it, and just the data behind it, what we're seeing in these vaccines?
Yeah, as you probably know, the vaccines that are currently available to us in the United States have gone through a process called emergency use authorization, which isn't quite the same as a full FDA approval, but it's still a very rigorous process. And we have three vaccines that have received emergency use authorization. Those are the Moderna, Pfizer, and now the Johnson and Johnson vaccine. And there were not any special exceptions in terms of the look at the safety and efficacy of these vaccines as they went through the process. And then after the vaccines received emergency use authorization, the FDA continues to monitor for adverse events, and they're logged on a publicly available website. And to date, over 100 million vaccines, COVID-19 vaccines have been administered in the US, and by all accounts, they appear quite safe. It is a new vaccine. All of them are, in this past year introduced. Like any new medication, it's right to be, thinking about long-term side effects, and that could potentially occur with any medication. I will say that for most vaccines, side effects tend to occur really early on, in the first days or weeks after the infection or after the vaccination. And to date, with so many vaccines given over the course of several months, we've seen very few dangerous reactions. And to date, zero deaths have been linked to the COVID vaccine, despite so many millions of doses being administered in the U.S. And there are no known serious long-term side effects of the vaccine. And it's really important also to think about what are the risks of not getting the vaccine. And that, of course, is the risk of getting COVID itself. I had mentioned this before, but an average 55-year-old has about a 1 in 250 chance of dying with COVID-19. But that can go way up if that person happens to have comorbid conditions. Not to mention they could spread the infection to their susceptible coworkers or family members. In addition, if they were to develop non-lethal complications like chronic lung disease, that could have huge impacts on their quality of life going forward.
So one of the questions that's asked is, hey, if I have already had COVID, even, why should I get the vaccine? Didn't I build up immunity? Didn't, am I okay? Do I need this vaccine? And what is the medical response to that question?
Yeah, so one reason to get vaccinated is because you don't want to suffer the infection. Another good reason is that the vaccine actually works better than natural infection to prevent you and protect other people from getting the virus the second time. That's the main reason to get vaccinated after you've had an infection. Your doctor may recommend delaying your vaccine about 3 months after you've had an infection, but that's simply because the period right after an infection is where you're least likely to get reinfected. But certainly reinfections can occur, especially more than 3 months after an initial infection. And that's where the vaccine comes in.
A lot of discussion in the news about the other strains of the coronavirus. Talk, if you will, about the vaccines that are available now and their impact or no impact on these strains. Where are we right now in that conversation?
Yeah, these new variants are concerning, and while the vaccines do appear a little less effective in preventing infection with certain variants like the South African strain, vaccines retain their effectiveness in preventing severe infection or death with those strains. And so you're still way better off getting vaccinated than you would if unvaccinated if you were exposed to one of these variants. And I would add that one purpose of the vaccination is to stop the virus from spreading before these variants can take hold in the community.
What advice do you have for those who are looking for information, looking to be educated? They've made a decision not to be vaccinated, but now they're leaning toward being vaccinated, but they want to educate themselves before they make that decision. What resources are out there? Where would you push someone to go to be able to get that information, accurate information about the vaccines here in the U.S.?
Yeah. In Virginia, there's the Virginia Department of Health website, which is updated frequently. That's vdh.virginia.gov, and also has news and updates about variants in the state and other COVID-related guidance. I believe there's a cdc.gov /vaccines is the national sort of corollary for that. If you go to the website, cdc.gov/vaccines, upper right-hand corner, it'll say COVID-19 vaccination. In there, you'll find comprehensive information about each individual vaccine, including safety profiles and efficacy information as well. If you're kind of a nerd like me and you're interested in like rates of COVID across the country, Google Johns Hopkins COVID map, and it has a really user-friendly portal to view COVID rates and to help you kind of make that decision making. And for the variants, New York Times has a COVID variant tracker that I find helpful as well.
From you to our public watching this video, what message do you want them to really take away from this? Coming from an expert in this field and knowing what we're up against, what is your message to our communities out there?
Well, it's just that the COVID vaccines have really been, a gift. I think science has led us to a point where we can develop a vaccine to a novel disease within the course of a year, which is incredible. And not only is there a vaccine, but it's one of our most effective vaccines ever developed. And while it's every person's decision whether or not to get the vaccine. I would really advocate for everyone to really weigh the risks and benefits, not only to themselves, but their coworkers, their family, and their community, both when thinking about the vaccine, but also, wearing a mask and trying to keep everyone safe.
Very good. Dr. Madden, thank you so much for sharing your insight with us today and with our community. And we appreciate your time and look forward to maybe speaking with you at another time when we can look back and see where we are, maybe 6 months from now or a few months from now, and see where we've progressed. But I do appreciate your expertise and your time, and thank you for sharing that with our viewers.
Thank you, and stay safe and well.
All right. Thank you very much.